Okay, Mr. Rogers, so I'm going to start my head to toe. I am going to put this here, if that's okay with you. I'm going to inspect your pupils, and they are a size 4. I'm going to check for constriction. I'm going to have you focus on an object behind me, or over there. Okay, good job. Alright, your pupil's constricted. I'm going to have you follow my finger. Alright, great. So Perla is present. The pupils are equal, they're round, and reactive to light and accommodation. Can you say "ah" for me? I'm going to check your mucous membranes. Okay, and it's pink, moist, and intact. There's no sores or any lesions. Alright, so Mr. Let me write that down. Perla. Okay, I'm gonna lay this back down. Alright, so I'm gonna button your gown so I can listen to your heart and to your lungs, so I'm gonna do that. I'm going to check for skin turgor and it's non-tinting. I'm gonna inspect the chest and it's symmetrical. Colors appropriate for ethnicity. I'm gonna listen to 8 positions in the front and 10 positions in the back. So I'm gonna have you take a deep breath. And then okay, and lung sounds are clear. I'm going to listen to your heart sounds. I'm going to start on the second intercostal space on the right, the aortic. S1, S2 heard. Then the second intercostal space on the left, the pulmonic. S1, S2 heard. I'm going to move down to the third intercostal space on the left, Erb's point. S1, S2 heard. And then the fourth intercostal space on the left, tricuspid. S1, S2 heard. I'm going to move to the fifth intercostal space, mid-clavicular line, the mitral valve. S1, S2 heard. And then I'm going to listen with the bell for a couple seconds. And there's no murmurs noted. I'm going to listen here for 1 full minute. Okay, your apical pulse is 88. Mr. Rogers, have you had a cough?
Yes.
Okay. Is it non-productive or productive?
Productive.
Productive, okay. And what color is it?
White.
Okay, and is it thick or thin?
Thin.
Okay, and if I give you a cup, about how much is it?
Probably about 5 milliliters.
Okay, alright, so something that would help with that is cough and deep breathing exercises, because it opens up the passages, your lung passages, and it helps move out the mucus. And it also helps lower the risk for infections like lung infections like pneumonia. And I would also encourage increasing your fluid intake because it helps thin out the mucus. Alright, so now I'm going to move to the abdomen, and I'm going to lift your shirt up, and your abdomen is flat. There's no mass. This color is appropriate for ethnicity. I'm going to listen to your bowel sounds. I'm going to start in the right lower quadrant. And the right upper quadrant. The left upper quadrant. And the left lower quadrant. Okay, bowel sounds are present. Mr. Rogers, I'm going to palpate your abdomen. If you feel any pain or tenderness, let me know. Okay? Do you feel any pain or tenderness down here?
No.
What about up here?
Nope.
Okay, and what about over here?
No.
And down here?
No.
Okay, alright, perfect. So there's no pain or tenderness upon palpation. Mr. Rogers, what did you have for breakfast? I had coffee and a bagel. Coffee and bagel. Okay, alright. Okay, alright. So, okay. So, Mr. Rogers, when was the last time you had a bowel movement?
Last night.
Okay. And was it, what color was it?
Brown.
Okay. And did it have a smell to it?
No.
Okay. And what was the consistency of your stool? Was it soft, hard,
It
watery?
was soft.
Okay. And what was the amount on that? Was it small, medium, or large?
Medium.
Medium. Okay, right. So I'm gonna wash my hands, and I'm gonna put clean gloves on, and I'm gonna inspect your genitals. Alright, I'm gonna just cover you a little bit, and there is clean. There's no swelling or any sores or any drainage. I'm gonna cover you back up. I'm gonna take these gloves off. I'm gonna wash my hands. Mr. Rogers, when was the last time you urinated?
Yesterday.
Yesterday, okay. Okay. And what color was it?
Clear.
It's clear, okay. And did it have a smell to it?
No.
Okay. And was it clear or cloudy?
Clear.
Clear, okay. And what was the amount on that?
About half a urinal.
Okay, alright. Okay, alright. Did you have any pain?
No.
Any urgency?
No.
Okay, and what about the frequency? Did it change?
No, it's normal.
Okay, okay, alright, good. Alright, so bowel movement. We're down. Alright, so I'm going to check your radial pulses. And they're 2+ bilaterally. I'm going to check your radial pulses. And they're 2+ bilaterally. I'm going to check capillary refill. And it's under 3 seconds. I'm going to inspect your IV site, and it's clean, dry, and intact. There's no swelling or any redness or signs of infiltration. It's dated for today, and Mr. Rogers, I'm going to flush it whenever I come back to administer your meds. I'm going to have you push up on my hands, then push down. I'm going to have you grip my finger. Alright, perfect. So +5 on the strength. +5 strength in the upper extremities. Okay, alright. Alright, Mr. Rogers, I'm going to move down to your lower extremities. And, alright, and I'm going to inspect. Color is appropriate for ethnicity. Skin is warm to touch. Let me see. Warm to touch. I'm going to check for edema. And there's no edema present. There's no skin breakdown up here either. I'm going to wash my hands again, and I'm going to put gloves on. I see that you have a wound on your right heel. I'm gonna inspect it, and it's clean, dry, and intact. I'm going to check your dorsalis pulse, and it's +2 bilaterally. I'm gonna check your posterior tibial pulse, and that's 2+ bilaterally. I'm gonna check your capillary refill, and it's less than 3 seconds. I'm gonna have you push down on my hands and then push up. So the strength on the right leg is +4, and on the left leg is +5. Okay, so I'm gonna take my gloves off. I'm gonna wash my hands again. Alright, Mr. Rogers, is there anything else I can do for you before I go and call the doctor?
No, thank you.
Okay, alright, so before I go, I'm going to make sure that the bed is in the lowest position, the rails are up, your call light is within reach. Okay, I'm going to open the curtains and wash my hands. So you can turn it off.